would you advocate for differences in the way that Missouri and St. Louis approach their public health infrastructure, and what would those be?
Yeah, no, that's a good question. In addition to those other roles that I've had, I was also an associate dean at SLU's College of Public Health, and so I feel really this is an important topic to me personally. And you're absolutely right that funding for public health has suffered in the state of Missouri, and it has nationwide, but particularly in the state of Missouri. And that you sort of get what you pay for, and so that has shown up during the pandemic as well. Years ago and in other countries, there's not as much of a separation between healthcare delivery and public health. That schism seemed to have happened, centuries ago, and we've been fighting it ever since. But to your point, there does need to be more collaboration between those public health entities and the healthcare delivery system, and really is to maximize benefit for community health, which is one of the role that I'm moving into now. I would say prior to the pandemic, I had worked with the health department, but not nearly to the degree that we are now. One of the things that we've come to understand is healthcare delivery system, and I don't think it was anything new, it was amplified during the pandemic, is that there are communities that are more at risk for disease, and I think we all know that. But this was just much more significant because it was so rapid in the way that it happened. And so, that brought to the forefront this really need to focus on community health interventions more so than, the absolute delivery of medical care. Because at the end of the day, if we can prevent somebody from getting sick, that's better for the patient, it's better for the community. I would argue it's better for the healthcare system as well. But it's brought a lot more focus on that part of health.